So the ear and hearing health are almost two separate things for this pharmacy. On a daily basis, I can see up to 5 people from different walks of life and all ages and stages, where it might be a small child where mum wants to just assess, is it an ear infection? Or it could be, I have pain in my ear and we're trying to diagnose what that is. So these assessments are coming into our advanced clinical practice through our triage system. And through the triage, we can then be referring into the ear clinical health. And in the future, I would just love that we can offer this service of earwax removal as a free service to the public, paid for by government or by CCGs in England. If you're in England, in Scotland it would be health boards. The bottom line is this service is invaluable, and I think not just the ear health, where we can diagnose otitis media, otitis externa, and we can prescribe treatment plans for them to get them well from the pharmacy. Who would have thought that we could do that in a small space of time? But the world is opening up to pharmacy, the world is opening up to us, and as clinicians we need to embrace the world that we're now being allowed into.
The remote review feature has been very handy to be able to sell even to the clinicians and the doctors next door. When they've seen what the technologies we've got, they've obviously been quite impressed because they realise it's very worthwhile, and the level of information we can give them and show them, they've obviously been quite impressed. I don't even think surgeries have that level of recording equipment, so it's been taken on very well for the doctors.
As an independent prescriber, the service that I'm offering to patients is not just earwax removal, it's ear care as a whole. I can identify other conditions when I'm in the ear and then actually prescribe here in clinic. The patients are getting more than just earwax removal, they're getting an ear checkup, they're getting us, they're getting a healthcare professional looking in their ear who can then actually prescribe for them, and they don't then need to be referred on to the GP.
We used the remote review service when I had an absolutely fantastic patient of ours who's a very good friend, and he was showing some signs of perhaps having an ear perforation. Now, I didn't have the expertise to really understand what I was seeing, and so what I needed to do was upload those pictures from Tympa, send them on to the experts, and within an hour I'm getting advice and guidance on what I need to do. And in that particular incident, the advice and guidance was to refer onwards, and then I got complete support in understanding the how to do that and sending off a superbly professional document which went off to his doctor.
So for patients who access this service, it's now a one-stop shop for clinical ear care. We see the patient here in the pharmacy, they get an examination, we make a diagnosis and they get their treatment here in store. There's no going to the doctor anymore. We've got prescribers here in the pharmacy that, like myself, that can, if they need unatomized ear spray, we can prescribe that. If they have a swimmer's ear, we can identify that and give them appropriate treatment. It's a one-stop shop for patients, and if I was a patient, I would think that was brilliant. I don't need to be going multiple places to get that. If I need my ears checked, I go to the community pharmacy for that.
I think the service Tympa gives in the local community is a great thing, because you don't have any long waiting lists to go and see an audiologist at the hospital. You can get your treatment within days rather than months, and the difference to your life is fantastic.